cardiac effects. And the first negative effect is that the pro-inflammatory cytokines tend to suppress the heart as a pump. And so when you really need that blood, say for example in sports people, when they're active in sport, they need increased blood supply. If in fact they have raised levels of pro-inflammatory cytokine, either relating to chronic helplessness or due to a recent infection, their heart muscle may be impeded and they don't derive adequate levels of blood, and they may in fact move into an acute cardiac failure situation. The second effect of pro-inflammatory cytokines, which has now been shown quite conclusively, is that it is associated with the development of coronary artery disease. It narrows the coronary arteries and so lays you open to cardiac infarct or heart attacks. Also, bear in mind that this is a generalized condition, so the effects of the coronary arteries are similarly replicated in the effects of the cerebral arteries, thus giving rise to the possibility of stroke, as well as into the peripheral arteries of the leg, giving rise to peripheral vascular disease. The next effect of pro-inflammatory cytokines are a very important study. In fact, several have shown a direct cause and effect of raised levels of pro-inflammatory cytokines, giving rise to insulin resistance and subsequent type 2 diabetes. And this is individuals who have had no family history, who have been careful in terms of their diet, have been exercising regularly, suddenly develop the positive fly sign. What is the positive fly sign? Well, in the old days, when an individual had diabetes, say an individual, a male, went out and urinated, a few drops landed on his shoe, and this was high in glucose, and the next thing, flies started gravitating around his shoe, and sure enough, this became the positive fly sign. And suddenly the individual comes to you and says, it's impossible that I've got the positive fly sign. I am young, I have no family history, I have been eating well, exercising regularly. And then you ask him, in fact, have you been in an entrapment, hopeless, helpless life situation for a length of time? And sure enough, you will invariably find that influence. This has been shown now in several studies and in fact is now fully validated. The next thing that the raised pro-inflammatory cytokines give rise to is that of osteoporosis or thinning of the bone. Osteoporosis used to be exclusively a condition seen in perimenopausal women, women who were menopausal. But more recently, we have begun seeing osteoporosis in younger males, and this may well reflect a chronic, hopeless, helpless entrapment life situation. Finally, we have seen the effects on spinal disc degeneration. Now, I had always regarded spinal disc degeneration as being a mechanical problem, but it became apparent that spinal disc degeneration was associated with raised levels of pro-inflammatory cytokine, and so we see something that was previously regarded as purely a mechanical problem is now subject to the effects of a chemical, the raised levels of pro-inflammatory cytokines. Now, as they say on TV, this is not all. In fact, pro-inflammatory cytokines circulate back into the brain, where they wreak havoc. Now, we know that there are serious effects of pro-inflammatory cytokines on the brain because, in fact, we've injected pro-inflammatory cytokines in normal individuals. So, for example, medical students, and you often use medical students who are a bit short on money to do certain testing of toxic substances, and so we've injected pro-inflammatory cytokines in happily adjusted medical students. In fact, remove them from lunch, take them into a dark back room, give them $50 and say, give me a vein, I've got to test some substance, don't worry, you won't die. And we've injected the substance and seen what has happened over the next half hour to 40 minutes. And what we see is individuals who were previously happy and engaging life now become totally disinterested, very irritable, non-cooperative, just want to curl up into a ball. Some of them get a fever. Some of them lose their appetite. Some even lose their libido. And believe me, for a medical student losing their libido, this must be incredibly toxic substances. And so pro-inflammatory cytokines can be regarded as very toxic on the brain. Bearing in mind, in this particular situation that I was speaking to earlier on, we have situations in chronic hopeless helplessness where pro-inflammatory cytokines are circulating through the brain on a continual basis. And so, in fact, we recognize certain very negative effects, which I will outline in detail. The first effect is that it impedes the production of serotonin and dopamine. And in this way, it further perpetuates this negative cycle. It causes anxiety by dropping the levels of serotonin, and it negatively affects personal gratification, motivation, sense of achievement on all the higher functions. The second thing that it does is it gives rise to the production of raised levels of cortisol, which, as we've said earlier on, sensitizes the amygdala, thus giving rise to a fear situation, and by causing raised levels of cortisol, it perpetuates the process. Raised levels of cortisol also suppress immunity, and so we see here is the link whereby those mind states which gave rise to raised levels of pro-inflammatory cytokines actually suppress immunity by pushing up raised levels of cortisol. Now, the pro-inflammatory cytokines impact on a very important area of the brain called the hippocampus. The hippocampus is that seat of short-term memory. It's also the seat of contextual memory. And so that if, in fact, it impacts negatively on the structure, we lose our short-term memory, we lose context. Now, bearing in mind that all memory is, in fact, contextually based, if, in fact, we affect the hippocampal function, we can't find where we've actually stored these memories. Not only can we not create the new memories, but we can't find the previously stored memories, and so it has this negative effect on short-term memory. And if this continues long enough, we have already shown in terms of MRI scanning that cells die off and the hippocampus has been shown to diminish in size. Now, you'll also appreciate that if, in fact, we lose hippocampal function and we have several episodes per day of disorientation, it will move into confusion, and this, in fact, would lead to what many have already theorized. It gives rise to the possibility of Alzheimer's disease. Alzheimer's patients have, in fact, raised levels of pro-inflammatory cytokines, and they also have atrophy or loss of brain volume in the temporal lobe in which sits the hippocampus. So there's a lot of important possible evidence that Alzheimer's is the end result of this spiral continuing over long periods of time. Also bearing in mind that movement is mediated by dopamine. If this process of diminished production of dopamine continues for too long as a result of raised levels of pro-inflammatory cytokines, we have in fact postulated the possibility that Parkinson's disease may be the end result of chronically low levels of dopamine. This then is the full catastrophe. This is in fact the final chemical manifestation of chronic hopeless helplessness, chronic hostility, anxiety, and chronic stress. And so we have come to realize that chronically raised levels of noradrenaline directly stimulate raised levels of pro-inflammatory cytokines, giving rise to all these effects that I've described. It should also be noted that the brain requires a threshold level of dopamine levels for its function. And if in fact we are running low on dopamine levels, the brain creates activities and behaviors in us which cause us to raise our levels of dopamine. So things that in fact raise levels of dopamine are exercise, which increases both serotonin and dopamine, as well as eating, and therefore a tendency to overeat, drinking, preferably alcohol and coffee, and sexual activity. Also, several drug groups raise levels of serotonin and dopamine, such as the SSRIs that I've spoken about earlier on. There are also drug groups that increase serotonin and dopamine. And then there are all the recreational drugs, heroin, cocaine, ecstasy, etc., which also increase levels of dopamine and serotonin, and in certain cases also noradrenaline. But as we would like to say right at the outset, it is far better to establish a meaningful activity that creates meaningfulness, a sense of purpose, a sense of achievement, and the space to do it in, for that is the more sustaining aspect of raising and maintaining levels of serotonin and dopamine. And so this is where the coaching modality comes into its own. For the Triangles model creates this platform for coaching to directly access the chemistry of wellness, performance, and